The first warning, COVID-19 exposed global surveillance weaknesses. WHO 2021 reports nearly half of countries lacked core capacities to detect outbreaks early. Hospitals, clinics, and labs often missed initial signals, delaying responses. New tech now continuously scans global health data in real time, aiming to catch emerging infections before they escalate, giving nations precious days or weeks to prepare interventions, allocate resources, and prevent widespread crises. Data is the new frontline. Blue Dot, an AI outbreak tracker, flagged COVID-19 days before official reports. Nature 2020 notes it analyzed airline patterns, health data, and news to predict hotspots. This demonstrates how AI-driven data fusion transforms early warning, enabling authorities to respond faster than traditional reporting. Early alerts allow travel advisories, targeted testing, and resource mobilization, turning data into actionable foresight for pandemic preparedness. AI predicts spread patterns. AI modeling proved crucial in predicting COVID-19 spread. Lancet Digital Health 2020 reports AI improved prediction accuracy by 30% over classical models using travel, mobility, and social behavior data. By identifying risk zones and projecting hospital demand, AI helped governments pre-position resources, enforce targeted lockdowns, and guide public health messaging. Such predictive systems are becoming a cornerstone in preparing for the next pandemic threat globally. Sequencing variants fast. Platforms like NextStrain track viral mutations in real time. NextStrain 2021 notes thousands of genome sequences were analyzed daily, reducing variant discovery time from months to days. This allows scientists to flag dangerous mutations, update vaccines, and guide policy decisions rapidly. Real-time genetic surveillance transforms response, giving nations a strategic advantage in anticipating viral evolution and preventing uncontrolled spread in the next pandemic. China. Wearables as early sensors, smartwatches and fitness trackers detect early signs of infection. Nature Medicine 2020 reports heart rate and temperature deviations indicated COVID-like illness up to 4 days before symptom onset. Passive health monitoring at scale provides early warning across populations, enabling targeted testing and isolation. Integrating wearables into public health networks could dramatically improve detection speed and response coordination for future outbreaks, potentially. Rapid vaccine tools, mRNA platforms, and AI-assisted design revolutionized COVID-19 vaccine development. Science 2021 notes vaccines entered human trials within 63 days of genome release. AI optimized spike protein targets, accelerating testing and production. Such platforms can be adapted quickly to emerging pathogens, shrinking the gap between outbreak detection and effective immunization. Rapid vaccine tech is now a central pillar of global pandemic preparedness strategies. Global Alert Networks, WHO's epidemic intelligence from open sources, EOS, ingests millions of digital reports daily. WHO 2022 states AI analytics improved signal detection by 40% versus manual monitoring. Real-time alerts allow epidemiologists to track unusual clusters of illness and respond before outbreaks spread. Linking labs, clinics, and media monitoring systems, EOS demonstrates how continuous global surveillance enhances situational awareness for early pandemic intervention. Contact tracing apps. Digital contact tracing complements human epidemiology. NEJM 2021 reports countries with high app adoption saw significant reduction in COVID transmission rates. Apps using anonymized data traced exposure chains, alerted individuals, and guided testing. Integrating such systems into public health policy creates a rapid feedback loop, allowing authorities to identify emerging clusters, focus containment efforts, and prevent uncontrolled spread in densely populated areas. Testing tech acceleration. Rapid diagnostic testing expanded exponentially. Find 2021 reports over 500 new PCR and antigen tests developed in the first year of COVID, surpassing all previous outbreaks combined. Faster, accurate testing identifies cases sooner, enabling quicker isolation and treatment. Combining testing with AI analytics improves outbreak mapping and resource deployment. Rapid diagnostics are now critical for detecting and containing infections before they escalate globally. Genomic lab networks, global labs shared virus sequences through platforms like GISED. Cell 2022 reports over 10 million sequences uploaded, enabling worldwide variant tracking. Real-time collaboration accelerates vaccine updates, therapeutic research, and policy decisions. Integrated genomic networks turn raw data into actionable intelligence, helping nations anticipate mutations, prepare health systems, and coordinate cross-border responses, strengthening preparedness for future pandemics. AI in hospital capacity. AI now predicts hospital and ICU demand during outbreaks. Nature Medicine 2020 reports models forecasted COVID-19 surges with 85% accuracy, allowing hospitals to pre-position beds, ventilators, and staff. These tools optimize patient flow and reduce overwhelmed facilities. Early modeling supports emergency resource allocation, minimizing mortality and improving system resilience during future pandemics. Predictive supply chains. AI-driven logistics track PPE, vaccines, and essential supplies. Deloitte 2021 notes predictive algorithms cut delivery delays by 70% during COVID-19. Systems anticipate shortages, reroute shipments, and optimize stockpiles, preventing bottlenecks. Automated supply forecasting ensures frontline workers and vulnerable populations receive critical resources quickly, a key lesson for preparedness planning in future outbreaks. Drone delivery for medicine. Unmanned drones delivered vaccines and tests in remote regions during COVID. The Lancet 2021 reported a 60% reduction in delivery times in rural areas. AI navigation systems optimized routes in real time, avoiding hazards and weather delays. Such technologies expand access, enabling rapid deployment of critical medical interventions in hard-to-reach locations during the next global health crisis. Digital twin simulations. Digital twins model entire cities to predict outbreak spread. MIT 2021 shows simulations identified high-risk zones and optimal intervention points. Virtual populations allow testing lockdown strategies and hospital deployment without real-world risk. These predictive environments give authorities the ability to plan preemptively, reducing transmission and casualties in future pandemics. AI in vaccine distribution. AI optimizes vaccine allocation. WHO 2021 notes algorithmic models prioritize high-risk populations first, balancing supply and demand globally. These systems prevent wastage and ensure doses reach the most vulnerable quickly. During COVID, such approaches accelerated immunization campaigns, and they are now integral to preparing for the next outbreak. Real-time epidemiology dashboards. Johns Hopkins 2020 COVID dashboard processed millions of global case reports daily. Real-time visualization allowed governments and citizens to understand outbreak trends immediately. Dashboards combine testing, hospitalizations, and deaths, highlighting hotspots. AI integration enhances predictive insights, enabling rapid, evidence-based interventions in future pandemics. AI for variant risk assessment. Next strain and GISED track viral mutations in real time. Nature 2021 reports AI models predicted which SARS-CoV-2 variants were likely to spread fastest. Early warnings inform public health decisions and vaccine updates. Predictive mutation modeling is crucial to prevent sudden surges caused by more transmissible or vaccine-resistant pathogens. Global health collaboration. COVID highlighted global coordination gaps. WHO 2022 emphasizes integrated networks like GORN connecting labs, hospitals, and governments. Sharing cases, sequences, and research enables faster action. AI supports real-time data analysis, creating a global intelligence network capable of detecting emerging threats and coordinating multi-country response efficiently. Social media as early warning. AI now scans news, blogs, and social media for outbreak indicators. Nature 2020 reports early signals of COVID-19 appeared in Weibo posts and Twitter feeds before official announcements. Algorithms filter noise and identify trends, giving health authorities a chance to investigate and respond proactively to potential outbreaks. Privacy-preserving surveillance, contact tracing and surveillance systems balance privacy and safety. NEJM 2021 notes apps using anonymized data successfully reduced spread without exposing personal information. Techniques like differential privacy allow AI to detect patterns and alert authorities while protecting civil liberties, an essential consideration for adopting digital health technologies widely. AI-assisted testing prioritization. During COVID-19, AI helped prioritize testing sites based on population density and risk factors. Nature Medicine 2020 reports AI algorithms directed testing resources to hotspots, reducing undetected cases by over 25%. By analyzing demographics, mobility, and case reports, AI ensures testing reaches the right communities first, enabling faster containment and more efficient public health response in future pandemics. Telemedicine expansion. COVID-19 accelerated remote care. Lancet Digital Health 2020 reports telemedicine visits increased tenfold, reducing hospital crowding and exposure risk. AI triage systems assist doctors by analyzing symptoms and suggesting tests or treatments. Combining telehealth and AI improves access to care and ensures rapid response to outbreaks without overloading physical clinics. AI-powered epidemic forecasting. AI models predict outbreak waves using mobility, climate, and social behavior. PNAS 2020 shows predictive models forecast surges up to 4 weeks ahead with 80% accuracy. This foresight allows governments to implement targeted restrictions, optimize healthcare resources, and inform the public, reducing spread before cases escalate uncontrollably. Autonomous surveillance drones. AI drones monitored public spaces for crowd density and mask compliance during COVID. IEEE Transactions 2021 notes drones detected potential high-risk areas and relayed data to authorities, helping enforce guidelines. AI-driven aerial surveillance provides real-time situational awareness, enabling rapid intervention and reducing transmission in urban environments. AI for antiviral discovery. Machine learning accelerated drug repurposing during COVID-19. Nature Biotechnology 2020 reports AI analyzed millions of compounds, identifying potential antiviral candidates weeks faster than traditional methods. Early drug discovery reduces treatment lag, saving lives and providing better pandemic preparedness for emerging infectious diseases. Global vaccine cold chain optimization. AI optimized vaccine storage and transport. WHO 2021 highlights predictive systems that maintain cold chain integrity, reducing spoilage by 20%. Real-time sensors monitor temperature, humidity, and location, alerting operators to anomalies. Efficient cold chains are critical to ensure vaccines reach populations safely during global pandemics. Wearable early detection networks. Integration of wearable devices into public health networks improves early warning. Nature Medicine 2020 notes widespread adoption allowed detection of infection clusters before symptoms emerged. Aggregated data fed AI models that track disease trends in near real time, enabling proactive testing, isolation, and resource allocation. AI in hospital resource allocation. Hospitals used AI to predict ICU demand and staff allocation. Nature Medicine 2020 shows predictive algorithms reduced ICU overflow by 15 to 20% during COVID waves. AI evaluates patient vitals, bed occupancy, and local case trends, guiding administrators to dynamically adjust staffing, ventilators, and equipment, improving patient survival and hospital efficiency. Wastewater surveillance with AI. AI analyzes wastewater samples to detect viral outbreaks. Science 2021 reports early COVID detection when sewage preceded clinical case spikes by 4 to 7 days. Algorithms track viral load trends across neighborhoods, giving health authorities advanced warning and allowing targeted testing and interventions, a crucial tool for future pandemic preparedness. Rapid genomic sharing. GISED and other platforms enabled real-time genome sharing. Cell 2022 notes over 10 million SARS-CoV-2 sequences were uploaded globally, helping track mutations. AI analyzes sequences for emerging variants, informing vaccine updates and global response strategies. Rapid genomic collaboration accelerates detection and prevention of dangerous viral strains. AI for global risk maps. AI combines travel, population, climate, and health data to produce real-time risk maps. Lancet Digital Health 2020 reports predictive mapping identified high-risk regions weeks before outbreaks escalated. Governments use these maps to allocate resources, implement travel advisories, and plan interventions, improving preparedness and reducing the global impact of future pandemics. Automated symptom checkers. AI chatbots and symptom checkers guide millions in self-assessment. NEJM 2021 reports such systems reduced unnecessary hospital visits by 30%, directing patients to testing when needed. Large-scale adoption allows real-time monitoring of disease trends, feeding data to health authorities for early detection and faster outbreak containment. AI in global supply forecasting. AI predicts shortages of PPE, vaccines, and medicines. Deloitte 2021 notes predictive algorithms cut stockout risk by over 60% during COVID. AI tracks production rates, transport routes, and consumption trends, ensuring essential supplies reach hotspots before shortages escalate, a key lesson for future pandemic resilience. Drone-based testing and delivery. AI-controlled drones deliver test kits and medications to isolated communities. The Lancet 2021 reports delivery times reduced by 50% in rural areas. AI navigation ensures safe, efficient routing despite weather or terrain challenges, expanding healthcare reach and providing rapid pandemic response where traditional logistics fail. AI-enhanced contact networks. AI models simulate social networks to predict disease spread. Nature 2020 found that identifying superspreader connections reduced transmission by 20 to 25%. These simulations inform targeted interventions, quarantine measures, and vaccination strategies, enabling efficient, data-driven outbreak management. AI for vaccine prioritization. AI ranks populations for vaccination based on risk factors. WHO 2021 reports algorithmic allocation improved early coverage among high-risk groups by 15%. Optimized prioritization reduces deaths and severe cases, ensuring equitable distribution while maximizing public health impact during the next pandemic. AI in early mutation alerts. AI flags dangerous viral mutations in genomic sequences. NextStrain 2021 reports real-time detection of SARS-CoV-2 variants helped update vaccines promptly. Early alerts prevent uncontrolled spread of highly transmissible strains, enabling governments to adjust public health strategies before large-scale outbreaks. AI in public health decision support. Decision support platforms analyze multiple datasets simultaneously. SAIS 2022 notes AI-assisted dashboards help officials simulate interventions, forecast hospital loads, and assess policy outcomes. Rapid, evidence-based decision-making improves pandemic response speed and reduces human error in high-stakes situations. Integrating climate and health data. AI predicts how climate affects disease emergence. Nature 2021 highlights models linking temperature, rainfall, and vector patterns to outbreak likelihood. Integrating environmental and health data allows authorities to preemptively deploy resources, preparing communities for climate-driven disease risks that could trigger future pandemics. The future of pandemic preparedness. AI, genomics, wearables, drones, and global networks form the next defense line. WHO 2022 emphasizes human oversight remains essential to avoid errors and ethical issues. These technologies accelerate detection, improve response, and reduce mortality. But the synergy between AI and coordinated human decision-making will define preparedness for the next global pandemic.